Knock, knock. Hello, Susan. My name's Kaylin. I'm the student nurse today. How are you and baby doing? Good. Okay, awesome. I'm just here to do a quick assessment on baby. Do you need anything while I'm in here? Awesome. Well, I'm gonna get started with baby. If you need anything, let me know. All right. I need my stethoscope. Thanks. Alrighty. So I'm gonna start by listening to baby. So I'm gonna get baby opened up before he starts crying. I'm gonna check band while I'm here. Yep, that matches mom's name. All right. Listening to heart sounds, bowel sounds, and respirations respirations and heart rate for a full minute. Heart rate's 137. Respirations are 40. Bowel sounds are active. That's wonderful. Mom, when was the last time that baby pooped? Awesome. Now I'm just checking my head, baby's head. Mold is good. And fontanelles are present. Suture lines are also present. And the difference between the caput cystidium and the caput is on both sides of the head and it's more of a fluid, and the cephalhematoma is the blood that's on the one side of the head. All right. This baby must have came out of C-section because it has a perfectly round head. No scratches are noted, so that's very good. And eyes are symmetrical with the ears, with that placement being very good there. Head is not too squishy, so I wouldn't say that it's got any fluid or any hematomas. And let's see. It does have a little bit of discharge from the eyes, but that is normal from the ointment that was put on. And ear has no recoil, so that could be an issue. It's supposed to have good recoil, but I can't even pull it. But we'll talk to the doctor about that one. And then, let's see. I'm gonna move on to the nose are open. We can check both sides. Looks like he's breathing on both sides of that. He's also screaming because he's not a fan of what we're doing. Let's see. I'm gonna do a skin assessment really quick, keeping baby covered. So there is a little bandage on the tummy, so it could have been nicked in birth. The cord is present and adequate healing for the 24 hours. There's no redness or anything noted there. On the hands, there's no multiple creases, more than one, so that's good. One could mean Down syndrome, and that would be bad. All right. Pull the baby's shirt back on. Keep him warm. And then I'm also gonna check the clavicles. Baby doesn't seem to be in distress. They are firm. Arm is has really good range of motion, as does the head. I can also check range of motion in the knees by putting legs up, making sure that these are even. But baby's being a little difficult, so that's not gonna happen right now. temp, you can check temp axillary. Normals are 97.5 to 99.3. Pulse normal is 110 to 130, and respiration is 30 to 60. Let's see. Turgor is good. Skin color is also good for 24 hours. We have good venous return. And then check for jaundice is forehead, chest, abdomen, thigh, and then back to the eyes. I don't know any jaundice at this time. Let's see. I didn't find any birthmarks or anything in that nature. So respiratory distress, there is 5 signs. They can be nasal flaring, they can grunt, they can have retractions, which is breathing into your ribs instead of out, and apnea that lasts longer than 20 seconds, so stopping breathing for 20 seconds, and then the seesaw breathing, so one side up instead of both sides symmetrically raising and falling. So I'm gonna put gloves on, check the suckle reflex. So that will be finger down, under, and then suck. Did great, no issues there. And then, let's see what we can do. We can palpate the neck for any masses. None are noted. And then we can check muscle tone by putting down, up, back down. And then there was some arm recoil there. Same with this side. Arm up, down. Arm recoil there as well. So we can check the genitalia. We just have to don gloves. Baby's foreskin is intact and there is adequate rugae over the scrotum, which means that this is a term baby or can indicate term baby. And we can check the testicles for descended, yes. Descended testicles, so you can push there and make sure that you can feel both, which I do. And then we can cover that back up. Awesome. Count fingers and toes. So baby has 10 fingers and 10 toes. The urethra was also noted in that. So it is midline where it should be. And there is a very good amount of creases in the baby's feet. So that can also mean term baby. We can do, if this was a female baby, it would have, we would want to make sure that the labia majora cover the labia minora. If it didn't, we would indicate maybe a preterm baby. Also discharge, white, a little bit of bloody discharge is normal for mom's hormones, and that as well. We can try, reflexes, the startle reflex, so picking it up and dropping, and baby should make a C and come in, and that was visualized there. Baby's behavior is normal for a 24-hour-old baby. So I'm going to turn baby around. We're going to look at spine. So starting at the top, spine seems very straight. No dimples are noted. Sacral dimples, no sacral dimples are noted. You can also check for the Mongolian spot, which baby doesn't have. No skin conditions are noted here. No hair on the sacral area either, so that's a good thing. We're gonna turn baby back around and keep baby warm. And ask mom when the last time baby ate was, and we already asked for baby's bowel movement. So we're just gonna get baby warm again, and all covered back up. All right, and then mom, do you need anything else while I'm in here? Awesome. Okay, well, put on your coat if you do, and we will come and help you out. Thank you.